Class 4, protecting your physiotherapy. It is very common for people to say that in physical therapy it only got worse, or that they have been doing physical therapy for years and have not improved. Possible reasons for lack of progress in physiotherapy: stagnant daily life or incorrect therapy. Further discussion and adjustments may be needed in upcoming sessions. Look, I am a doctor specializing in neurosurgery. I discovered my passion for the field during my training, which led me to specialize in treating conditions of the brain and spine. The other doctors do not understand much about what the syndrome is, what can be done to change that. And the physical therapist, the same thing. There are good physical therapists who understand the syndrome and provide great care. For example, I have some who specialize in that. But there are others who treat knee pain, foot pain, herniated disc problems, and even minor shoulder issues. And then they don't understand the mechanism as much like you understood in the previous class. And therefore, they don't prescribe the correct exercises. This class is designed to help you gain a comprehensive understanding of the rehabilitation process, enabling you to make informed decisions on the appropriate actions to take and those to avoid. It is crucial to seek guidance from a qualified professional to ensure effective rehabilitation. Or could you please inform him that I am unable to perform this exercise, doctor, as it may aggravate the condition and make it worse? This lesson will be divided into 3 parts. What should not be done, what should be done, and what can be done but won't solve your problem. What should not be done. Guys, in previous classes we discussed the imbalance where the muscles pushing your shoulders and arms forward are stronger than those pulling your arms back to stabilize the scapulae. This leads to postural issues and potential shoulder problems. From this explanation, it is clear that exercises involving arm movements that bring them together towards the front, aimed at building chest muscles, should be avoided due to potential limitations. So, for example, exercises like squeezing the ball, chest exercises, bicep exercises are great for targeting different muscle groups. The bicep attaches to the scapula, pulling it forward, hence affecting shoulder stability and mobility. These exercises and the strengthening of these muscles may inadvertently lead to your shoulders becoming more forward, exacerbating your symptoms and discomfort. Therefore, the least you should do in the sessions is to ensure that you do not make any mistakes. So, if your physiotherapist says, oh, but we'll only do it this time, this will help you, this will just a little bit, no problem. It's important to trust their professional judgment and guidance. Yes, because you're there with pain, your anterior muscles are too strong, what should you do? It is stretching this musculature, releasing the chest, releasing the biceps, and not exercising to strengthen it, because if you strengthen it, your arms will become heavier, and it will be much more difficult for you to maintain your correct posture throughout your days. The second part is focused on enhancing pain management strategies, offering relief but not addressing the root cause of the issue. This can help him, especially during the period when you are in pain crisis, when you have many trigger points that do not allow you to even start the essential exercises, but you should not make your physical therapy treatment just that. This part consists of trigger point releases, myofascial releases, which are those massages, those releases of points that cause you pain, especially during a crisis period, can be done, will help you with the pain, will relieve your symptoms. In addition, the shocks also, the TENS, will help improve your symptoms during the periods of greatest pain intensity so that you can later do the exercises that are essential to maintain your correct posture. Of course, Dr. Thomas, I already understand very clearly what actions I can take and those I should avoid. But now what should I do? If you still don't know the process, then let's go through it step by step together. But for you to fully understand the reason for this, please recall the content covered in the previous classes. A posture problem due to excessive strengthening of this region because it stays forward for too long, a weakness in the posterior muscles because the arms are always forward. So what should we do? To improve posture, it is important to stretch the chest and biceps regularly. Additionally, focus on enhancing flexibility to ensure you can easily retract your shoulders and strengthen the muscles in the back, especially the ones located between the shoulder blades. These exercises will contribute to maintaining a more upright and comfortable posture during your daily activities. It is essential for you to undergo this treatment correctly, because if you only treat the trigger points, you will be back in the same place in a few weeks. If you can consistently strengthen the correct muscles through targeted exercises and effectively release the overly tight muscles, you will significantly improve your posture and prevent the reoccurrence of troublesome trigger points that often disrupt your daily activities. Do you understand now that before you were merely addressing the symptom of the gorge, which is the pain, and now you will focus on resolving the root cause of the gorge, which is the incorrect posture. This shift will lead to more effective treatment. If you have difficulty finding a physical therapist in this area, one option is to look for an osteopath, who is usually the professional who works the most in this area. Another intriguing aspect to consider is emphasizing exercises that involve longer durations, increased repetitions, and reduced weight to enhance endurance and muscle toning. Later on, we will talk about weightlifting, how harmful it can be in this case. And physiotherapy is the same thing. We have to strengthen the muscle that helps you for several hours a day, not the muscle that helps you in 6 repetitions because you trained it with weight. Watch this class again, especially if you are unsure whether your rehabilitation exercises are being performed correctly today or not. Double-check your form for optimal results. In this way, you will be able to understand if what you do, if the sessions you are paying for rehabilitation are being carried out correctly, if they are helping you in the long term, or just spinning your wheels. In the next lesson, we will talk about the weight of your arms. It may sound crazy. You won't find this in many books or scientific articles, but it's something I've understood that makes a huge difference in facilitating the whole process of correcting posture.